Today we will answer some important questions about obsessions. Where does your intrusive thoughts come from and what happens in the brain of someone with obsessive compulsive disorder? Do you have obsessive compulsive disorder and what are differences between obsessive compulsive disorder and just normally being obsessive? In this video we're gonna answer these questions. Hello everyone, this is Dr. Masoud and I'd like to discuss topics about mental health, neuroscience and productivity. Have you ever been stuck with a specific intrusive thought, whether the thought is fear of contamination, excessive checking or harming others? So let's get straight into it. What is OCD? The OCD is mental disorder that is characterized by obsessive intrusive thoughts which are fixed and hard to control. These thoughts are usually ego dystonic, which means they are against your self-image or the way you look at yourself. They are usually followed by compulsions. Compulsions are behaviors that you do to relieve the distress caused by your obsessive thoughts. For example, if you have intrusive thoughts about contamination or infection, you might start to wash your hand excessively to relieve the distress caused by obsessions of contamination. Thoughts are usually trivial to ordinary people, but they are really threatening to people with obsessive compulsive disorder. But obsessive compulsive disorder is not always typical, which means sometimes the patient only suffers from obsessions without having compulsions to relieve the distress caused by obsessions. So how does obsessive compulsive disorder starts and what are the symptoms? As we said, obsessive compulsive disorder is characterized by obsessions, which are obsessive intrusive thoughts that are fixed and hard to control, and they are usually followed by compulsions, which are behaviors to relieve that distress. They are severe enough to interrupt your daily activity and functioning in social and work domains. If your obsessions and compulsions are not severe enough to interrupt your daily activity, you will not be regarded as someone with obsessive compulsive disorder. Among people with obsessive compulsive disorder, the most common obsessions are fear of contamination, excessive checking and aggressive obsessions. The aggressive obsessions are like when you don't like someone, you start to develop obsessions about harming him, even though you know it's socially inappropriate and you have no real intentions to do it. The most common compulsions are excessive checking followed by washing compulsions. Also need for symmetry and counting compulsions. So how usually obsessive compulsive disorder starts? The onset of OCD is usually preceded by stressful life events like birth of child, job loss, death of family member, or other forms of psychological trauma. Additionally, OCD symptoms worsen under stressful situations. Patients with OCD suffer more from daily life stress compared to controls. Sometimes loneliness makes OCD symptoms worse. Okay, and here's a very important question. Do you have OCD? As with any other mental disorder, you might have symptoms without having the disorder itself. Like for example, you might be sad for long duration without having depression. Also, you might have obsessions and even compulsions without having obsessive compulsive disorder. Your obsessions and compulsions should be severe enough to interrupt your daily activities and functioning to be regarded as obsessive compulsive disorder. If they are not that severe, this will not be regarded as obsessive compulsive disorder or mental disorder. Now we will come to most interesting part for me, which is what happens in brain of someone with obsessive compulsive disorder. When we look at the brain of someone with obsessive compulsive disorder under fMRI and compare it to normal controls, the areas that are abnormal include basal ganglia, prefrontal cortex, orbitofrontal cortex, anterior cingulate cortex, thalamus and amygdala. These areas are responsible of self-awareness, self-control, thinking, emotional regulation, sensory processing, anxiety, and detecting errors. Which means complex neurological and psychological factors play a role in OCD. When it comes to biochemical changes in the brain of someone with OCD, studies have found the medication that does not affect the serotonin system lacks efficacy in treatment. The obsessive compulsive disorder is even more complex than what you might think. For example, different types of obsessions has different neural correlates. For example, those with checking compulsions exhibit activations in globus pallidus, putamen, dorsal cortical areas, and thalamus. And those with washing compulsions exhibit increased activations in bilateral ventromedial prefrontal cortex and caudate nucleus. Okay, does OCD affect your body and overall physical health? Of course, there are some very important bodily changes happens to patients with obsessive compulsive disorder, and these changes include alterations in plasma, stress hormone, cortisol levels, and ACTH levels. Cortisol levels are somewhat proportional to the severity of obsessive compulsive disorder, and this increase in cortisol levels could affect your cardiovascular and metabolic health and eventually cause cardiovascular diseases and obesity. We will not deep dive into the relationship between mental and physical health because it's a huge topic, but overall OCD or any type of psychological stress could affect your sleep, metabolic health, and overall physical health. That was all about OCD for today. If you are interested in mental health, neuroscience, and productivity, follow for more.